Welcome to the Concierge Medical Marketing Podcast, the show dedicated to helping concierge medical practices grow and thrive. Hosted by Schwartz, a digital marketing expert with over 25 years of experience and a passion for improving American healthcare by helping concierge medical physicians succeed. Here's Schwartz.
Hello and welcome to the Concierge Medical Marketing Podcast. I'm your host, Steve Schwartz. Today, it's my privilege to have John Rothwell, NP from Island Direct Primary Care, as my guest. He's based in the Melbourne, Florida.
Brevard County, yeah.
Okay.
So we call it the Space Coast.
Yes.
Because we're right here next to the Space Center. And you actually, my practice, we watch the rockets go up. So it's really, really cool.
Exactly. We see the rockets launch from here in Vero Beach, Florida as well. We're 80 miles away or something, but it's nothing at all like being in Merritt Island or Titusville watching the rockets get shot off. It's just, what an amazing opportunity.
Yeah, we love it here. So it never gets boring, that's for sure.
Yeah, absolutely. So as a practice owner, we're thrilled to have you on the podcast today. What I'd like to do, John, is have you share a little bit about your background, where you grew up, your schooling, what made you want to get into medicine, and then we'll talk a little bit about why direct primary care.
All right, great. So grew up in Jacksonville, North Carolina. My dad's a Marine. My grandfather was Army, so World War II, Vietnam. I was in the Middle East, so I'm a combat veteran as well. And so we were at Camp Lejeune, North Carolina. Got into medicine predominantly because in 1978, when I was a kid, I actually had a blood disease, and they couldn't figure out what it was. Was it leukemia? Was it hemophilia? But at the end of the day, I ended up spending about a year in the hospital, having a splenectomy, and next thing you know, my blood levels went back to normal, and I was able to do all the things that I never thought, and they never thought that I would be able to do. And so I had this utmost respect for my hematologist and oncologist. And then, of course, the nursing staff that took care of me, they were kind of very, very influential. So I always wanted to kind of give back similarly because of what they did for me. So in the beginning, I was going to be a hematology oncology nurse. And then next thing you know, I found myself in the U.S. Army as a flight medic, and I flew search and rescue and medevac when the Apache helicopters first came out. And that ended up kind of going to nursing school and then just trying to figure out what was next, med school, PA school. But I really liked that traditional model of caring for people. And so nursing brought that to me. And so the nurse practitioner seemed like the way to go at the time.
Nice. Well, let me say thank you for your service to our country in the military. It's something I've always truly respected, our men and women who put their lives on the line for the freedoms that we all enjoy here. So thank you. Awesome. How long were you in the Middle East, and what kind of situations did you deal with without, giving away any privacy stuff?
Yeah. So look, I was in the Middle East for 9 months, and, it's trauma care, right? What's interesting is, when you take the flight medic aspect out of it and you're taking care of a military unit, there's a lot of preventative healthcare. And so you focus on healthcare prevention so that soldiers don't get sick, so that they are strong and able to deal with injuries and those kind of things. And then, of course, naturally, building with nutrition so that they have strong immune systems because you're in different environments. And so it's kind of interesting to see where I was then as a young man, 19, 20, 21 years old, to now in my mid-50s. And my approach to care is still somewhat similar. A little bit more holistic probably, and not one directional as the military can often be. Yeah, I was 9 months in the Middle East. I was 11 years total in the Army. And during that time, I spent most of it enlisted because I liked being out in the field versus I already worked in the hospital. So I worked in the cardiovascular ICU. I worked in the ICU. I worked in the emergency room. And so that was my predominant nursing background until I became a nurse practitioner.
What bases? I assume you were on military bases all this time, other than your stint in the Middle East?
Yes. So when I was on active duty, I trained in Fort Jackson, South Carolina, then went to Fort Sam Houston for medical training, flight training, Fort Rucker in Apache Training Brigade in Fort Hood. Then we were kind of like what they call a core unit. So it was not just individuals. The whole entire unit trained in Fort Hood, Texas, and they picked the whole entire unit up. They moved us to Cotterbach, Germany, which is right outside of Ansbach, about 25, 30 kilometers from Nuremberg, which has a tremendous amount of history in the World War II era. And then they picked us up, the whole unit up from Katterbach, and sent us to the Middle East. And then again, picked us all up and sent us back to Europe. And so kind of very, not a special operations like a Green Beret type thing, but it was very, unique, specialized unit. And so those were my active duty locations. I spent time in the Florida National Guard. I spent time in the New Hampshire National Guard as well.
What a career. What country were you in the Middle East?
Yes.
Yes.
So if there's a country in the Middle East, I was probably there.
Okay.
So
you caught me off guard there. Like, yes, never heard of it. Now, there's obviously been a lot of hot spots in the Middle East for U.S. troops to go over the last couple of decades. So again, thank you for your service. Appreciate putting yourself in harm's way to help as you did. So let's pivot our discussion just a little bit. You got back, you had all this medical training, you've had lots of experience, and you decided direct primary care is the direction you wanted to go. What happened? How did you make that decision? And tell us a little bit about creating your business.
So that journey is a little interesting. So when I got back from the Middle East and went to college, got my nursing degree, and I was working within the current healthcare system. Actually, it was when DRGs and managed healthcare was first coming out. So let's think of, late 80s, mid 90s timeframe. So obviously DPC is not quite that old, though it's greater than 15 years. But how it influenced me to where I'm at today is that's when I was able to determine the system was broken, because the insurance companies were dictating, how we cared for our patients, how long our patients were admitted, and those kind of things. And so much so that I was considering leaving. We ended up leaving healthcare. We left Florida, moved to New England. So we lived in New Hampshire. And you know what? The same system was there and it was broken. And so I actually got out of healthcare and I got into technology. So we were moving from dial-up internet. So I got into dial-up high-speed data transport, synchronous, asynchronous, and worked my way up from kind of like a sales guy to, the director of sales, then to director of global sales, then to the vice president. And then my last job, I was chief sales and marketing officer for a tech company. So I was part of 6 different startups. And then 2008 happened. And when that happened, I crashed with 2008. And so I lost everything. But what I didn't lose was that nursing degree that I had. And I didn't lose the passion for people. And I had already been looking at partnering with my primary care provider on trying to create a new way of healthcare delivery. I didn't know what that was. Concierge medicine was relatively new at the time. So I didn't, I kind of thought it looked like concierge medicine, but I wanted it for everybody, or at least anybody who was willing to make the investment and sacrifice to get the healthcare that they needed. I didn't want it to be based off of, household income and that kind of thing. And so concierge medicine tends to have it costs too much or it's too expensive. And so long story short, the next 7 years, I went to college again, got my bachelor's, master's, doctorate, worked in the ER, did all the things I taught. I became a faculty member at University of Central Florida. And the day I graduated with my doctor of nursing practice, I had a huge party, big hog roast for all my family, friends, had a band. When everybody left, I don't drink, so I was nice and sober. And I sat down and started writing my business plan. And when I did that, I ran across direct primary care. And I'm like, that sounds a lot like what I want to do compared to this. Now, I still was kind of like, but do I want everybody in my practice? Am I going to take everybody? And being in the tech field, there was a small company called Cisco Systems. And Cisco really kind of made a name for themselves by not being a creator or an inventor, but being an innovator in the sense of, from a marketing perspective, they would take other people's products and put their label on it, right? And market it as their own. And so it was a good quality product, but they would market it as their own. And so the Cisco had a brand and these kind of things. So I'm like, you know what? I don't have to reinvent the wheel. I can take the wheel that exists. So some of the physicians that started direct primary care out in Seattle and, leaders like Josh Umbar in Kansas and stuff like that, Clint Flanagan in Colorado, Eric Crawl in Tampa. All these physicians just did a great job of presenting it in their communities and making, getting the literature starting to report and reveal some of the statistics on direct primary care. It made it easy for someone like me who had a degree, as a doctorate degree. I know how to read the literature, and there we go. We built a business plan for Brevard County. So I was the first direct primary care practice in Brevard County, which is 70 miles long and, not too wide.
Fantastic. Definitely leading the charge in Brevard County. And being here in Vero Beach, we have our little newspaper that comes out once a week. And it seems to me, as I thumb through that newspaper, there's a new direct primary care concierge branded practice nearly every week. It's amazing growth that we're seeing in our area. And I know it's across the country too. So it's exciting that you were sort of on the forefront of it for this area of Florida.
Yeah, definitely this area, the forefront. I think, there's about 1,200 of them when I got into direct primary care. Now there's well over 3,000. So I've mentored 3 other practitioners here in Brevard County to open up their direct primary care practice. And so people would say, hey, John, why would you do that? That's competition. I've been a rugby player for 35 years. I just retired in August at 54. And I love competition, but I don't look at other direct primary care practices as competition. I look at them as other colleagues who are educating the community on the values of direct primary care. And so hopefully direct primary care continues to build its foundation of why direct primary care is different than everything else, so that we can continue to grow it. And we're seeing it now. I mean, I think, Robert Kennedy in his congressional hearings, right? I think it was like minute 55, he was talking about direct primary care. And so that's kind of cool to see direct primary care finally getting the attention that it needs at a federal level, not just in a local level.
I think there's going to be a lot of exciting changes in the next couple of years here. So many things, no matter what side of the political fence you're on, there's so many things that are being looked at very critically and saying, does this work? Does this not work? Is it have a good return on investment? Is it terrible return on investment? Is the money being used well? Is the money being thrown away and set on fire? And again, this is not a political show, but I'm grateful personally that we're looking at things with a critical eye so that our country can be more healthy, our country's finances can be more healthy, and to the topic of DPC and concierge medicine, that our people can be more healthy. So I think we're in a really interesting place and time in our country's history to see improvements and literally let's change things for the better and not simply keep doing it, i.e. the insurance way, simply because that's how it's been done for the last umpteen years, right? It's an exciting time and I'm glad to be part of it. And I'm glad you're part of it.
Me too. Looking at things through a different lens, whether it's physical, mental, emotional, spiritual, financial health, or from a different lens as an entrepreneur, as a healthcare provider, integrative healthcare, traditional healthcare, functional medicine, whatever. What I love about direct primary care is the fact that you have the time to look at things through a different lens, and you're not just kind of pigeonholed into the healthcare system that we have today. And I think the challenge is getting the community to look at healthcare from a different lens too, and so, and that's the exciting part for me today.
Yeah, there's a lot of education that needs to happen. And, our podcast here is certainly focused on helping the physicians and the NPs and PAs that own a practice or operate a practice to help them succeed with their practice with effective digital marketing. But there's so much opportunity for the practitioners themselves to create content, let's say videos primarily, explaining what direct care looks like, how it's different from insurance-based, and how the outcomes in many cases are better. And in doing so, by being proactive about your health, you can literally save a lot of money, time, hassle, and stress in the long term, simply because you're identifying medical issues before they get really serious. I've shared a story on my podcast a few times. There's a practitioner I met at the Concierge Medicine Forum this last October, and she said that her practice has a 100% success rate in heart attacks. In other words, all of our patients, of every single one, they haven't had one single heart attack. Why? Because when they onboard the new patient to the practice, they do such an extensive tests and checks and backgrounds and everything they need to do. If a person had the risk factors for heart attack, they dealt with it proactively. So she and her practice have a 100% win rate of no heart attacks. So I love that. And we all know that it makes a lot more sense to identify something in advance, do what we need to do proactively to get it fixed, resolved, handled, so that we don't end up on the floor of our room with a heart attack or, worse while we're driving or whatever it might be. It's a beautiful thing that we're doing here.
No, I agree. And I love the fact that, she's bringing the patients in and she's measuring right away, right? Creating that baseline. That's probably one of my biggest sandbags with the current healthcare technologies, particularly electronic medical records system, is the reporting. The proof is in the data.
Yep.
And the existing data that's out there often is, like with lab work specifically, is not focused on the 54-year-old. It's focused on the, young, healthy individual. And I think with artificial intelligence coming on full force and machine learning and those kind of things, part of AI, if we get that embedded into our electronic medical records, not from a scribe perspective, because that's the only way we're really using it right now, but if we use it from a population health management perspective, we really have an opportunity to change outcomes in our communities. I'm super, super excited.
Yeah. Seeing AI and how it's truly exploded on the scene in the last 2 years still blows my mind. I use it every day for our digital marketing agency, every single day. And it's great that as the technology gets better, stronger, and cheaper and easier to use, people who are not tech nerds or whatever can learn how to use these tools and use them to save money, time, and effort and hassle and stress in their own practices and even, obviously other businesses as well. And I think what it comes down to it is knowing how to do the prompts correctly, because obviously garbage in, garbage out. And the more specific you can be with your AI prompts, the better outcomes you're going to get from whatever that machine program is telling you. But one thing you mentioned before is that you don't consider other DPC practices as competition, but instead as colleagues. And I think that's beautiful. And you're not the first person who's mentioned that on our podcast or to me privately. I think it's a great thing where we all understand that there is such a huge need for this type of medical service in our area and across the country. And so by sharing the information, sharing our experiences with other people who would traditionally be considered competition, they can be more successful and everybody can win. Along that line, would you be willing to share a little bit about, as you grew your practice from, I know now it's you plus 2 practitioners, plus you're interviewing and bringing on 1 or 2 more practitioners, you're serious growth mode right now. And it's so exciting. What challenges have you experienced when you're trying to grow your company? And how did you overcome those challenges?
So we're overcoming them, maybe not necessarily have overcome them already.
All right.
Obviously, we overcome part of it, and that is just getting enough patients to pay the bills, right? And so that has, we overcame that by getting involved in the community. So that entails lots of volunteer work. We volunteer for Matthew's Hope. We commit to New Life Missions, New Life International, Children's Hunger Project. I can go on. We're doing a 5K for fetal medicine this weekend. We did something with autism last week. And so we've just done it with a giving heart. And in return, people talk about us. Like, we're not the traditional healthcare provider that, takes an insurance company and people go, hey, are you accepting patients? I mean, sure, we get those phone calls, but most people find us organically or through the social media platforms where they just see us just doing stuff out in the community. And I've built an environment of that. And I think our exponential growth has really exploded because we've exploded our giving into the community.
Right. I love it. The generosity, the giving, especially for underserved underinsured, poverty
Yeah,
situations and whatnot. You're giving, and you're serving, and it's coming back to you big time.
it is. And so people look at it and say, well, John, we're not running a charity. We're not running a 501c3 here. We still need to make money. I have student loans to pay back. I mean, look, try being in your mid 50s and still paying your student loans because you went back to school at 39 for 7 years. I don't worry about that kind of stuff, but that's just me. I don't also, live a certain way. I live a modest means. We are not no longer, but up until January of this year, I was 40% more membership cost than the average DPC in Brevard County. But I'm the largest DPC in Brevard County.
Well, something you're doing is working.
And so that's the beauty of direct primary care, right? So direct primary care is a model, and each model has, different actors, right? I mean, in marketing, we talk about telling a story and making the consumer the hero or the business the hero, not ourselves. But there's always a Robin, there's always a wingman to these things. And so, like, when you're helping businesses grow so that they can reach their goals, whatever it is, whether it's to have one clinic and to have a full patient panel, or whether it's to have 10 clinics, it doesn't matter, because each person's goal and drive is different. At the end of the day, it's you who makes your practice, and direct primary care provides you the autonomy to do that, where you're no longer being dictated by different organizations on how you deliver care, or how you code care, or how you diagnose. And as a combat veteran, I love that, because I fought for freedom of choice. I do not believe in every decision my patients make. I'm not going to have the vaccine versus non-vaccine argument, with you or with them. But you know what? There's something to be said for freedom of choice. And so, as a doctorately prepared nurse practitioner or master's prepared nurse practitioner, as a physician, it's our job to educate the community on safety and risk and benefits and those kind of things. And direct primary care allows us the freedom to do that.
Touching on what you were mentioning about growth, you had mentioned word of mouth referrals as well as social media posting. Were those pretty much the two primary ways that you brought in new patients?
So my first hire was a registered nurse in nurse practitioner school. My second hire was a young lady who just graduated college with a degree in marketing. And so that's kind of a little backwards for most, but being a sales and marketing guy myself, I saw its value. And so her name's Danielle. And so I hired Danny to do business development and marketing. One, as a practitioner, I don't have time to spend 10, 15 hours a week creating new content and scheduling posts and looking at the data of when people are opening their social media platforms and when they're reading, right? People just post to post. That gets you nothing. People need to work with guys like you, because at what time this demographic is typically looking at social media, or they're typically online. That data is critical in your marketing efforts, especially if you're spending money on ad campaigns and stuff like that. And so I hired Danny to do that for me. And so she had a foundation, being a next generation or whatever, Gen Z, whatever we're in now. That's part of her education, is like, find out when people are on Facebook or on Instagram or LinkedIn, and let's dive in there. So I hired her to do that for me. And then I also hired her to go to the Chamber of Commerce, go to BNI, go to these different community networking events. So she did all of them except for the Florida Association of Veteran-Owned Businesses. And so I did that one, being a veteran, and brought her with me. And I let her qualify small businesses, because I believe that the real growth in direct primary care is going to be with the employers.
Completely agree.
Yeah.
Yep.
So it's already difficult enough in the healthcare industry for the entrepreneurs. Most of them do a fair job of B2C, so business to consumer. However, they don't have to do a great job of it, because people need a primary care provider because the insurance says so. And so people call and say, are you taking someone? And it's yes or no, right? Direct primary care is way different. And it's usually, hey, I got a really cool doc who listens to me, who spends an hour with me, who gives me their phone number and they can reach me through virtual care, text, phone, face-to-face, same day, next day, and all the things that we hear about direct primary care. And so people have a choice now to who they're going to do it. So it's slightly, the marketing effort slightly different. And so that's why having a good name out there is so important. That's where that organic word of mouth comes through. That being said, that's the B2C environment. When you get into small businesses, that is a relationship builder, right? You have to go in there and not take them donuts like people do the healthcare, the pharmaceutical companies bring you donuts and sweets and treats and candy and all that. I tell people, don't bring that here. We have raw nuts and we have fruit and vegetables. There's an obesity pandemic in our country for a reason. It's not going to be at my practice.
Love
and
it.
So anyways, on the employer side, I think we have to be out on the employers. And so that's the challenge. You have insurance advisors and brokers. There's a difference in those. And, you have organizations like Rosen Health or Health Rosetta that are doing a great job of starting to educate the benefits advisor broker community. And they're starting to present it because they're starting to be paid for it and finding that best solution. And so that's the challenge now, is getting an audience with the right business. For us in DPC, I think it's businesses less than 20 people. That makes up 89% of small businesses in our country anyways.
Right. Yep.
And so if there's 44 million small businesses out there that have less than 20 people, then why are we spending all our time going after these businesses that have 100, 200 patients at a time?
Yeah, the bigger the organization you're trying to sell your service to, the more hassle, paperwork, and whatnot you're going to have to deal with. And then if you're a practice with a couple of doctors, a couple of NPs, and you land a whale that has 5,000 patients, I mean, how do you onboard that many people? It's going to be its own hassle. Whereas if you onboard a team of 10 or 15, that's something you can do in 1 month without too much extra stress. I was thinking that as a separate podcast interview, I'd like to interview you and a few other practitioners on practices that you've gone through, methods you've gone through that you find effective to properly speak with and sign on employer groups to your practice. Don't have time for that today, but I think that would be a great topic that would help so many people across our country.
I think it's great. I spoke at the NP and PA DPC Launchpad a couple of weeks ago up in Charleston. And essentially, that's what I was talking about, was accessing the employer or small business market, right?
Yeah, I love it. Penny's great. And I hope to go to that conference next year. I heard it may be on a cruise ship. So my wife and I love cruises. So we'll see if we can figure out if we can get a ticket onto that one. This has been really great, John. I appreciate your heart. I appreciate you sharing so much of your experience. Again, thank you for your service to our country and the U.S. military. You seem like a great guy, and you're 45-minute drive north of where I am here in Vero Beach. So I want to find a time to drive up there and take you out to lunch and eat something healthy. But to get to know you better and to see your practice and meet your folks, I think would be an awesome opportunity.
I would love that, and we're going to be opening up Main Street Direct Primary Care down on Main Street in Melbourne. Hopefully within the next couple of months. So we're finalizing the pieces of getting permission from the city, so to speak, or the permitting to do some of the things that we want to do. So we're excited. So look forward to meeting you down there for lunch sometime. That'd be great.
Yeah, that sounds great. And before we close the interview, I just wanted to share briefly my company, Concierge Medical Marketing. We are a digital marketing agency that helps DPC and concierge doctors and practitioners with their digital marketing to get a full panel. And we call that the growth program. And there's specific digital marketing techniques and strategies that we offer to our clients to help them grow. We also offer transition. That's a different program that's focused on a practice that may have 2,000, 3,000, 4,000 patients, and they decide they want to have a DPC arrangement. So how do you market to your existing patients to encourage them to join the cash only practice? How do you educate them? How do you show the value and the benefit? And then third and final, we have a program called Nurture. And for practices that are full panel, maybe even a healthy wait list, we understand that members need to feel loved. They need to feel appreciated. And through digital marketing techniques of reaching out to the existing patients and the wait list to nurture them, emails, text messages, maybe ads on social media, ads on CNN, Fox News, and the History Channel, just even get-togethers at the office, planning quarterly events and whatnot. We offer a program to help the patients feel engaged when they're not visiting their practitioner. So those are the 3 programs that we offer to our clients. And we're happy to help anyone who's listening to the podcast who maybe needs some help in those 3 areas. I've also written a book called The Definitive Guide to Winning with Digital Marketing for Concierge Medical Practices. And the book is available with my compliments to you totally free. Visit conciergemd.marketing. And on the homepage, scroll down where you'll see a cover of the book. Simply put in your email address and click the submit button. Our system will send you a link where you can download the PDF. Please read the book, take it with my compliments. And obviously, if there's any questions you may have, something doesn't make sense, or you need help digging further into your particular situation with your practice's digital marketing, please reach out. I'm happy to chat. We offer no obligation consultations. You can put a time on my calendar, cmmkg.com/schedule. And that'll show you a little calendar when I'm available. Pick a time, fill it out, and we'll hop on a call together, see how we can help you out. Other than that, John Rothwell, Island DPC. Thank you so much for your time and your heart. And I'm so thrilled to see your business grow. The impact that you're making in the industry is just awesome. So keep it up.
Hey, thanks, Stephen. Thanks for having me. And all you DPCers out there, good luck.
Yeah, totally. This has been Steve Schwartz with the Concierge Medical Marketing Podcast. Please like, follow, subscribe, share, and all that good stuff. And we'll see you on the next episode. Take care, everybody. Goodbye for now.
Thank you for tuning in to the Concierge Medical Marketing Podcast. Please subscribe and leave a review wherever you listen to podcasts, and stay connected with us on social media. To speak with Stephen Schwartz about growing your concierge medical practice, give him a call at
772-304-2420
or visit our website at conciergemd.marketing. We will see you next time.